So one of the great things about ultrasound is that we can do it in the office. It's cheap. It's about 1/15 of the cost of an MRI. It's very convenient for you as the patient because you don't have to go get the MRI and then come back and have me discuss it. And then people also don't like MRIs in terms of claustrophobia, the discomfort of lying down, and then a lot of patients, they can't get MRIs because of pacemakers. Another reason why it's really great is because I'm using the same machine all the time, so it's very consistent in terms of the images that I'm getting. So I'm actually more accurate looking at a rotator cuff with an MRI, right, or with an ultrasound machine right now compared to an MRI because it's the same every time. And also, I think a lot of patients think it's pretty cool to be able to see their shoulder when I'm looking at it with the ultrasound machine, and I can show all the images. All right, so let's do a quick exam. Okay, so what I first do is I have you start with your arm just like this, okay, and then we rotate slowly out, then right here, then I say grab your gun, and then we come back to neutral right there. Okay, so we start in the front of the shoulder. In the very front of the shoulder, you see between these two bumps right here is the biceps tendon. That's the long head of the biceps, and I probe up and down the biceps tendon, and I look to see if there's any fluid or any tears. Okay, and then I have you rotate out like this. Then the muscle that we see in the front is called the subscapularis. Okay, that's the rotator cuff muscle in the front, and I probe up and down, and you can see the muscle there, and you can see it move with the humerus, okay, which is pretty neat. So there's no tears there. Then we have you come back to neutral, and then the next part is I look at the long head of the biceps, and I look at it kind of along the longitudinal axis, and then I move in this way, and then I'm looking at the subscapularis again. Okay, again, I don't see any tears, all right. And then we move to the grab your gun position right here like this, okay, and I put the probe just on top of the shoulder, all right, and then what I'm looking at right here is the supraspinatus tendon. That's the very front of the rotator cuff, and it's inserting into the bone right here and again, and then I slowly move the probe back, and I'm looking again at the probe, at the tendon to make sure that there's no tears, okay, and then I turn the probe and I look at the tendon from another angle, right here like this, and I'm looking at the rotator cuff from the front to the back, okay, then here's the biceps tendon here, and I'm looking all the way across the back. So this is the supraspinatus and the infraspinatus, and we're probing, watching it come into bone right here. Again, no tears. And then the last part of the exam is when we look on the back of the shoulder right here, and we're looking at where the rotator cuff muscles insert into the back of the humerus, and we rotate the head and we see, and that's the teres minor there, and then just above is the infraspinatus, and then we can flip and look at those on the short axis again, okay? So that is the ultrasound exam right there. It takes so that's the ultrasound exam. It takes roughly 2 to 3 minutes. It's really quick, super efficient, and I think from a patient perspective, it really is superior to MRI in a lot of ways, and I use it pretty much in all my patients where I'm suspecting they might have a rotator cuff tear. And I think there's not a whole lot of surgeons that are doing this right now, and I think it's definitely something that I can offer to help save you money, time, and overall just to have a better patient experience.